healthy people, healthy humans don't hurt humans. Hurt people hurt people. That's how it goes. And if we look at it that way, then we need to understand that some of our, I guess, most needy or most impacted persons out here are young people. They tell us every day, without verbally telling us every day, that they're having some issues that are impacting their overall health, mental health, sociological health. When we see buttons on their shirt, when we see the images of dead relatives, RIP, tattoos all over their bodies, rap songs about killing and death, they're telling us every day that they're hurting. And we all, we hear stories about hurt that's not necessarily related to issues of violence, where we see, a husband come home and who's had a bad day or got, sort of reamed by his boss and come home, smack his wife, beat the kids, kick the cat, punch a hole through the wall. Another example of a hurt person came home and hurt other people. And in most cases, the person's closest to you. You don't necessarily go shopping for victims. So when you think about it that way, if we're not successful, and I think this is what the ultimate task and ask needs to be from myself, if we're not successful at, number one, identifying folks in our communities who are having issues with their health, sociological, mental, overall health, disparities in low birth weights and black women or women of color, period, then, I think I need to be clear what my work is going back. I think I need to be clear that I need to do a better job identifying what is a mental health experience. Like when we were talking about people acting up. And one thing we were talking about yesterday is not all of them are acting. So if we think about it that way, then maybe we'll deal with some of these behaviors, like it's an illness, like it's a family member who's hurting. Somebody, if we were effective, and because I come from a public health position, my job is not just to say, let me wipe this snotty nose. My job is to swim upstream a little bit and figure out how you, not where the cold came from, how you got in, how to prevent this from happening again. Dress a little better, like I was informed on my way down here. Dress for the weather. The snotty nose is just a symptom of a larger issue. Some of these mental health issues, as Big Brother told us last night, was as a result of some experiences that went on while the child was still in the mother's womb, in the mother's belly. And so some of these issues that we're seeing, bad health issues, bad mental health issues, issues of violence, are probably more likely as a result of us not identifying and being effective, addressing the true root cause of the issue, although we know we've been very effective addressing the symptom of the issue. So if there's an ask or a task that I need to take with me when I go back, is how do I do a better job? How am I going to be more effective going back? And I need to be told how to do that because I don't know everything.